The myth we are trying to solve today is hypnosis is a useful technique for retrieving memories or forgotten events. First, let's define the terms. Hypnosis is the induction of a state of consciousness in which a person apparently loses the power of voluntary action and is highly responsive to suggestion or direction. It is often used in therapy to try to help regain suppressed memories or change a behavior by suggestion. A suppressed memory is thought to be the mind defending itself by banishing traumatic memories from awareness, making victims unable to remember them until some years later. Some people describe it as a sleep-like trance state, but in reality, they are in a state of hyper-awareness. What I thought was interesting is that research has found that hypnosis does not lead to significant memory enhancement, but can actually result in false or distorted memories. Now let's move on to the history of hypnosis. Hypnosis seems to go years and years back, and it is hard to pinpoint a specific origin. The earliest evidence of hypnosis dates back to 1550 BC, found in Egyptian papyrus for healing. It was also used in Greece and ancient India for healing as well.
As Clara mentioned, hypnosis does not actually aid in memory enhancement. This belief possibly came from earlier psychologists who suggested hypnotherapy as a memory retrieval tool. Pierre Janet, Joseph Breuer, and Sigmund Freud endorsed hypnosis, while Janet was one of the first therapists to use memory retrieval as a tool to remedy trauma, such as in his 1889 case where Janet used age regression to free a patient from blindness that had been induced by the fear of seeing a fellow child with facial deformity. This myth has also been perpetuated by the media's influence, as it portrays hypnosis as a truth serum and cure-all for all forgotten memories. This is evident in movies like Kiss the Girls and Dead on Sight, where individuals are abruptly able to remember all of the details from a crime or forgotten events due to a hypnosis session. It has also been noted that hypnosis can lead to a heightened sense of confidence and reluctance to change answers despite being incorrect when related to the memories involving the technique, as exemplified in a study involving college students done by the State University of New York, Birmingham. The study asked participants to estimate the day, month, and year notable events occurred, as well as how confident they were that they were correct. Half the students were under hypnosis before giving their estimations in a booklet, and the other half was not. It was shown that those under hypnosis who put the wrong dates and were given the opportunity to edit the dates were not any more accurate than those who were not under hypnosis, but were more confident and less likely to change their answers when being told that they were wrong. The effect was noted to be subconscious. Memory isn't perfectly stored, it is prone to distortion and errors. Individuals who retrieve memories while under hypnosis are more likely to believe that those memories are accurate even though they aren't. Notably, during a period in the 1880s and the 1990s, there was a widespread epidemic of retrieving false memories of sexual assault during childhood through hypnosis. Additionally, in 1985, the American Medical Association warned against the accuracy of memories recalled through hypnosis. Furthermore, a study done at UCI found that hypnosis from as far back as the 1880s produced false memories. Their study also found that therapists from the 19th century admitted to implanting and modifying false memories onto their patients. The community whom this myth affects are those who seek hypnotherapy for stress and pain relief, as well as those who are licensed to practice hypnotherapy. Traditionally, hypnotherapy is used to cope with stress, pain, anxiety, and other mental disorders such as phobias and PTSD. Since there are two forms of hypnosis that could be utilized, suggestion therapy, which has been mentioned, or analysis, the latter is possibly a partial cause to the myth. It makes use of the hyper-focused state that one is under while hypnotized to survey the probable cause of an issue that could be resulting in a psychological problem. As these issues can lay in the unconscious memory, it can stir buried memories that are addressed in therapy. Additionally, since hypnosis allows individuals to open themselves up to suggestion, it's useful as an aid in procedures such as surgeries due to a relaxed state it can place individuals in turn leading to less stress and anxiety that could cause adverse effects on those undergoing procedures. Hypnosis is an aid to treatments, not alone. Due to this, it is not recommended for those with psychological disorders that leave them open to suggestion or those actively abusing substances, since it could cause an adverse effect and create more false memories. The use of hypnosis to uncover repressed memories connected to an individual's mental disorder is not recommended as the reliability of those memories are questionable. According to Penn State professor William Ray, it has taken years for hypnosis to gain medical credibility. This is due to the lack of reliable measurements of the ability to be hypnotized. It was not until the tail end of the 1950s that Stanford conducted an experiment that established measures of one's ability to be hypnotized. The result was that 95% of participants could be hypnotized. It also noted that a person's susceptibility does not change much as time passes, which was confirmed during the retest of individuals receiving similar scores 25 years later. Recent EEG tests show that hypnosis can take away certain aspects of pain while leaving others to remain, allowing for the patient to be not as affected. After the Stanford study in the 1950s, which created dedicated measures of hypnosis, it allowed for research to be conducted that led to the construction of validity.
So psychologists can help those seeking hypnotherapy if they want to recover their memories, that they should know the risks and issues with hypnosis because it will result in distorted or false memories. So psychologists can give a quick, simple history and explanation behind the effects of hypnosis to educate them. Furthermore, they should suggest an alternative and more reliable treatment if patients do wish to retrieve their memories. On the other hand, though, clinical psychologists themselves should reconsider using hypnosis as a technique. If they were to use hypnosis-based recovered memory therapy, the risk of false memories could be harmful for patients if they were to give their testimonies in court. Because furthermore, if jurors were familiarized with what took place during therapy, and there is evidence of suggestive therapy and implantation of false memories, the therapist will be blamed and held reliable for the client's false memories. Some authors in the research we found actually stated in their conclusions that therapists should practice empirically supported therapy practices rather than the risky and disputed methods such as hypnosis-based therapy. So those seeking to become therapists should be taught and aware of these facts and understand that one of the purposes of therapy is to ease the recalling of intense emotions from the patient's experiences, not implanting false memories on them or changing them up. So for both patients and psychologists, it is best to promote evidence-based treatment practices to prevent and lessen memory distortion in therapy.